I'm Amy Alton of doomandbloom.net. I'm an advanced registered nurse practitioner and co-author of the Survival Medicine Handbook, which you can find on my store at store.doomandbloom.net or on Amazon. Today we're going to talk about my new motorcycle kit. Motorcycles offer an awesome ride and also are the most fuel efficient transportation besides a bicycle. Prevention of motorcycle accidents is key to your safety, so be sure that you're always alert. You wear protective gear such as good footwear, a helmet, eye protection, some protective clothing, and gloves. What are some of the most common injuries? Well, you might find on motorcycle accidents you're going to get bone fractures, road rash, and also head injury, and that's why your helmet is super important. But let's talk about the new kit and actually what's in it. Now, this kit can also be called a biking kit or a hiking kit, so it's multi-purpose. So what's in it? Well, first let's talk about the gauze. We have a 6-inch roller gauze. This is great in case you get an injury on an extremity. You can cover it up with our square gauze, and you do have 4 of the Telfa gauzes. You could put one of those on and then wrap it and secure it with this. We do have 10 yards of cloth tape. You get that whole tape right there. So again, you can see you have another way of securing your Telfa pads. Now, Telfa pads have a non-adherent surface to them, and that's really important because we just talked about road rash. If you get road rash, we do have burn gel. Now, these burn gels are really interesting because they have lidocaine in them. At first, you're not going to be so worried about healing, but you're going to be a little more worried about the pain. So you want to make sure that you get some burn gel on there. Now, before, of course, you're going to put any kind of treatment on it, you're going to make sure that you clean it up. So if you just have your alcohol pads, that's fine. There are betadine pads in here. You have 10 of each of those. You have betadine and alcohol. So clean it up with something, put some burn gel on it, and then cover it up. If it's not too big, we have 5 regular sized Band-Aids here, and we also have the large Band-Aids, and those are really big. So if you get like a skinned knee or even an elbow, it's possible that these might be large enough to cover them. So you have lots of things to cover up rashes or scrapes or lacerations. Now, if you do get something that opens up a little bit, of course you're not going to be carrying a suture kit, you're not going to be stapling. Don't do that without your medical license, but you can take these tapes, which are really interesting. So go ahead, use the betadine wipes, clean it up. If you have some water, you can irrigate a wound. It's really good. You want to really clean something up. This is not going to seal it up tight. What you're going to do is you're going to put a little of this sticky strip on one side of it. You're going to pull it together and then secure it on the other side. And basically what you're just trying to do is get the 2 sides to come together so that more dirt and bacteria don't get in the wound, at least until you can get to a better place to clean up and get it covered. Now, if you have something a little more serious, we do have scissors to cut off clothing if you need to expose a wound. These are really super good. In fact, they're so heavy they can be used as a weapon. They can be used to cut your tape or, like I said, to cut clothing off. So you want to expose the wound. Most bleeding does stop with pressure. So what you want to do is use your pressure gauze to, just kind of put some pressure on it. Use your hands, get on top of it. If it's yourself, put as much pressure as you can stand on it. You want to be really firm. Like I said, if you can just put pressure on a wound, a lot of times you can stop the bleeding with just a gauze. So this is compressed gauze. This opens up, it's pretty amazing. It's 12 feet. It opens up to a really big bunch of gauze, and it's nice and compact, which is good because we're putting it in these small kits. So put pressure on it. If that is not working, you have a couple more things. This is a hemostatic gauze. It is Celox. I like this. It's a nice thin package. This works within 90 seconds. This is also something you have to push in the wound towards the bleeding. So if the bleeding is coming from the heart, you're pushing it this way. It's a folded up gauze in here. Push it in and hold it. You want to hold it where the bleeding's coming out, deep in the wound. You should hold it for 3 minutes. This one says you can hold it for 90 seconds, but I would still do the full 3 minutes just to be safe. You can get the bleeding control probably with this. Another alternative is to put a tourniquet on. You have an alternative that you can pick if you want to upgrade to the cat tourniquet, which is the Velcro base. The reason I don't offer the soft tee is because it's a little bulkier and it just doesn't fit well in there. If somebody really does want that soft tee, just write to me. I'm happy to exchange it. So this comes standard. This is an elastic band. It has the instructions on it. In fact, the name SWAT means stretch, wrap, and tuck. Super easy. This can be used as a compression bandage. It can be used in place of an ACE bandage. So really, really versatile. So that's why we put this in here. So that's your tourniquet. You do have an ACE. Like I said, your other tourniquet you can choose is the cat tourniquet. The ACE is a 4-inch. It is latex free, just so you know. And then, you know, if you were to stop the bleeding with, say, the Celox and the tourniquet, you would want to cover up that wound with something. So this is called a compression dressing. This has an elastic stretch, which is very similar to ACE. It has a sterile pad. So you put the sterile pad over the wound, wrap the stretchy wrap around, and then there's a little clip to secure it. So it works really well. Again, this can also be a replacement for the ACE. So if you had two places that you need an ACE bandage, you've got two alternatives there. Mylar Blankets. There are many purposes to Mylar Blankets. Keeping warm is the primary, and a lot of times when people have injuries, you'll see that the EMS, if it's kind of cold outside, that they'll just go ahead and cover this patient up, sometimes even if it's not cold. If they've gotten exposed to some wet, or if it's really some water, or if it's just really cold, go ahead and put a Mylar blanket over you. It also is reflective, so if you need to get a hold of somebody, like, hey, I have an injury, go ahead and put this Mylar blanket around you. It works really well. You have a light stick in here. I don't have it in my tub here, but you have a 12-hour light stick. Things can happen at night. You need to be able to flag people down, and you know, waving sometimes doesn't say I'm in trouble, but if you're waving a light stick, it's kind of a little bit more of a sign that there's something wrong. We do have some ibuprofen. You have a headache, you actually do hurt yourself, you've got some ibuprofen. Here's some more of the non-stick pads. And last but not least, you have something called a Splint. This is a moldable splint. And you know, we're thinking about a lot of times if you fall, and I did ride a motorcycle when I was younger. I had an Indian 100. Awesome, awesome motorcycle. I actually drove that thing when I was 8 or 9 years old. Amazing. Anyway, when you fall, what's the first reaction? You put your hands out, you know, to protect yourself. So you're gonna possibly have a fracture. This is very moldable. This is gonna help support the finger while you get to some care, and then you're going to wrap maybe some stretchy. You don't really want to tape it, because if your finger is broken and they're trying to pull the tape off, that's just going to hurt and maybe move your finger. So you're going to want to stabilize your finger, and maybe using the ACE wrap or even the Curlex would be good. So it comes in OD green, red, and black. I have put patches on here. You can take that off if you want. But most people are going to put this inside their seat or in a backpack, and you want to be able to scream, hey, get the pack with the Red Cross. It's very obvious, well, not a Red Cross, it's a White Cross, but it's very obvious that this is a first aid kit. So choose red, choose black, or choose OD green. It's your choice, and this is my motorcycle / biking hiking kit. Again, this is Amy Alton, a nurse practitioner from doomandbloom.net. Please come visit me over at my store. Thanks so much. Bye-bye. Be safe.
Hey, if you need a solid medical kit for that wilderness hike, hunting trip, or even long-term survival, check out Nurse Amy's entire line at store.doomandbloom.net. That's store.doomandbloom.net. You'll be glad you did.